The National Foundation for Celiac Awareness has staked claim to May as a way to raise awareness and support for those that suffer from celiac disease. Celiac disease is a genetic autoimmune disease which damages the small intestine. The small intestine is part of the gut which digests and absorbs nutrients from food. When the small intestine is damaged, the rate of nutrient absorption from food is reduced. Celiac disease can affect people in many different ways, and symptoms vary in severity. It's the only currently known autoimmune disease with a known trigger. The trigger is gluten. In the United States, approximately 3 million people have celiac disease, and 83% of those with the disease are currently undiagnosed. Left untreated, those with celiac disease are at risk for serious conditions such as osteoporosis, anemia, thyroid disease, and certain cancers. The specialists at Advanced Gastroenterology and Surgery Associates tell us more about the disease and how they treat it.
Celiac sprue disease is actually an autoimmune condition where the body, essentially in layman term, causes antibodies that will not allow the GI or the small bowel to absorb wheat products. Now, if you go into your food pantry and you look on the box, wheat is very prevalent. It's used in binding agent, it's used in many things that we eat, and people are not suspecting that. Now, the reason why celiac sprue disease is becoming more commonly known is because of the awareness in diagnosing the condition. The antibody causes the hairline in the small bowel to be blunted, and so when it fights against the gluten product, it causes the absorptive surface of the small bowel to be decreased. So therefore, then patients cannot absorb these products, and then they have symptoms. Symptoms then include things such as bloating, abdominal pain, diarrhea, and because the small bowel is very important for absorbing products such as iron, minerals such as B12 and so forth, and patients will then become iron deficient and they will develop anemia and weight loss because they can't absorb well. Now, patients will come to our office and say, well, you know, Dr. Tran, I have been on a gluten-free diet and I feel much better. That is not to say that they have celiac sprue disease, but they may have malabsorption to the wheat products or the gluten products. And I would say to them, well, if this makes you feel better, then this is something that you can stay on. But to be gluten-free, strictly gluten-free diet is very difficult.
Even though it seems so simple just to tell patients to be on gluten-free diet, but it is so difficult because the gluten is almost everywhere. You can see it in food items, you can see it even on makeups, and you have to ask the patient to read the label. It can be troublesome for patients because it can lose a lot of weight loss, the quality of life is not there, and it can put a patient at risk for vitamin deficiency, osteoporosis. They could even lead to cancer because some of these patients are at risk for lymphoma if they're not taking care of the problem. There are lots of overlaps in the presentation, so you have to be vigilant and also spend a lot of time to get all the details of their problem and try to eliminate as best as you can, because if they have celiac disease, they're going to have long-term consequences. So you have to make sure you have the proper and the accurate diagnosis for the patient so you can treat appropriately.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Sick of Celiac StoryLink icon on our homepage, yourhometownhealth.com.